It's about 6 months since my mother, who have end-stage Alzheimer's and have dysphagia or difficulty in swallowing, has been placed on a nasogastric tube. So I thought of doing an update on how she's getting on. Initially, when we brought her back from the hospital and we started placing her on nasogastric feeding, her digestion was not very good. Means that normally there's a feed every 6 hours, and her feed, and before we actually give the next feeding, we always have to use a syringe to actually pull up to see the contents of the stomach, and then of course we will have to return the contents back to the stomach after we pull up to see. And most of the time, even after about 6 hours, she still have undigested food from the previous feeding. So after a while, because her vitals were quite bad previously when she was admitted to ICU and later warded in the hospital, and it took some time for her body to recover. After about a month or so, her digestion started to get better, and now is like in about 4 hours she would have finished digest all her food. Just one thing is that she actually, because of the dysphagia, she's not able to really swallow or spit out her phlegm, right? And the irritation of the throat caused by the placement of the nasogastric tube, it caused a lot of phlegm and mucus build up. So this one, we have to always do the phlegm suction for her. She will always have phlegm. If the suction is not being done, I do it on average daily basis, and sometimes if let's say she start to cough, right, then I will do it 2 or 3 times a day. And normally when she start to cough, if I notice she start to cough and I start doing the suction, I will be able to pull out a lot of phlegm. Once I do it continuously, like 2 or 3 times a day for 2 or 3 days, her cough will stop, and then she would become okay again. To minimize the incident of coughing, we can try to actually get her, I find that getting her to sit upright or taking her out means I will get her to sit on the wheelchair, and then I will wheel her out to take stroll about an hour or so. It helps to actually, when she's seated upright, it will help her, especially smelling, breathing in the fresh air, it will help to lessen the incident of the cough, because one of the things that they tend to cough or they develop pneumonia is because they lie down too much, and then the fluid will build up at the back of their lungs. This is told by me by my mom's friend, who is a retired nurse who have taken care of such patients before. So that's why the phlegm is going to be an ongoing issue, so the suction has to be done, and suction always have to be done about 2 or 3 hours after their last feed, or right before the current feed, so that we make sure that if we do it like immediately, we can't do it immediately after feed, because it will cause the food from the stomach to go upwards. And then we have to watch over the sliding, and then also watch about the bed sore, because they are more bed bound. I also have to take care of her. She has to be on hand mittens. I always have to make sure the mittens are properly secured, because if she pulls out the mitten and once her fingers are free, she will try to pull her nasogastric tube out. Even with the mittens also, she will try to brush against her nose, because the tube irritates her, cause a bit of irritation and a bit of uncomfortable feeling. So of course, naturally she will try to rub it off. I also learned to actually find a way to properly secure her tape. I change it almost daily to make sure that the tape doesn't come off easily. Also, that the last two months I actually replaced, the hospital give default a plastic tube. I change it into a silicone tube, which actually helps. It produce less irritation to her and less mucus. So overall, after placing my mother on nasogastric feeding, my mother's life has really improved in terms of her mood, her disposition, because of the proper nutrition, the full nutrition that's going into her body. It has given her vitality back. She has regained her health. So in the last checkup we did about 5 months after being on the nasogastric tube, her liver function, because my mother have liver cirrhosis. Which she's actually on long-term medication, the entecavir, since 2017. So with liver cirrhosis, with diabetes, with cholesterol, and with high blood pressure, my mother is not that healthy. But then when we place her under nasogastric feeding, she has regained her health. I mean, with the liver cirrhosis, digestion is already not very good, and she still could do it. More so for other normal Alzheimer patients who have dysphagia. So definitely, I'm sure if they are placed on tube feeding and they are being well taken care of, they would be able to survive. It is not the end. You hear a bit of background noise because that's my mom talking her baby talk. And this is very different from a few months ago when she was in ICU. She was not really talking. She was like fading away. You see, if a person is not able to swallow, it's only the swallowing part that is affected. The digestion, everything, most of the time is okay. I mean, my mom already, the liver is not working, and yet now she can still digest the food. Not to say not working, but the function is being compromised. She can still able to do digestion. So, as I say, for other people, definitely the odds are better on them. And furthermore, my mom also had tonsil cancer in 21 years ago. So with radiotherapy, the passageway of her throat are very much narrow compared to a normal person. So when they place the tube for her, it's actually harder. And yet, she is still able to survive with the tube. So that is why when in other countries, when the person stops eating, becomes very weak, and they are placed on hospice, they say it's the end, they say it's transition. It's actually not. If we are willing to put them on tube feeding, they will survive. But just this very strong disclaimer, if they are going to be placed in an old folks home, a nursing home, memory care center, assisted living, means if we are not caring for them ourselves, then putting on a nasogastric tube is actually more detrimental for the person. Because once you put them on a nasogastric tube, you have to watch over and take care of them. They will require much more care compared to if you don't put them on tube feeding. But if we don't put them on tube feeding, and after a while when they refuse to eat, you can't get food eat, or they can't eat without choking and developing aspiration pneumonia, then the feeding is going to stop, right? If the feeding is going to stop, then what happens to a person that does not eat? There's only going to be one outcome. It's going to be the end. Whereas if we put them on tube feeding, there may be complications. Just like if let's say we want to go to surgery or we want to undergo any medical treatment, there's going to be possible life and danger complication. In the tube feeding, you see, she's singing. It makes me very happy. Okay. In tube feeding, the only complication, some complications are mainly like if the phlegm suction. If they have a lot of phlegm and then they can't swallow and they can't spit out, and we don't suck it out, we don't get rid of the phlegm is going to harden. So when it hardens, right, it may become a choking hazard and block the passageway. So my mother's GI doctor also said that have to do phlegm suction, have to really do the phlegm suction. and then once we can take care of the phlegm suction, then it is okay. And also at the same time, to prevent them to reduce the risk of developing aspiration pneumonia, get them always to be in a inclined position when you're feeding them, and depends on their digestion. If their digestion is good, 30 minutes after the food, they can lie down on the pillow at a slight incline. But if let's say the digestion is not good, you have to keep them on a higher incline for at least about 1 hour, 2 hours. Ideally, it's 2 hours. And when you keep them in the incline, you got to watch over them. That's why we can't send them to a nursing home, because if you want to put them on nasogastric feeding, even nursing home also won't take care, because they don't have that kind of resources. Because after putting on tube feeding, you have to basically sit by them and watch them, especially when they become active and they start moving around. They will slide, because sometimes they find uncomfortable to remain in an upright position. They want to rest, so they will slide down. They don't care, no matter what we tell them, they won't care, they will slide down. So we have to watch over them. So when we can prevent that from sliding down, then the chances of them developing aspiration pneumonia is not really there. My mother have coughed a few times, and I've actually gotten a chest x-ray done. The doctor told me she didn't have pneumonia, but the cough could be because of the phlegm, because sometimes when we pull the phlegm don't really want to come out. We can't get them out. So when we can't get the phlegm out completely, may cause them to cough. But with time and practice, right, when you keep doing, it's a skill. You will develop it. Initially, when I do phlegm suction, I was frankly terrified. But after that, I got used to doing. It can be done, actually. So with the phlegm suction, with the caring for her, my mother's condition has really improved. You can hear in the background noise, she's talking, singing on her own, in her own happy world. It's always up to us how we want to view it. And also, as a caregiver, we have to dedicate a lot of time to care for them. I don't know about other people. For me, when I saw my mom in ICU and I thought that she was dying, my heart was really breaking. I was really sad. So when we took her back, I have to care for her much more, and I have not gotten a full night's sleep in the past 6 months. Because of her feeding time, I have to adhere to her feeding time, and because she's on diapers, I have to change, and they tend to urinate a lot at night. So I have to change her diapers late. I have to get up early also, I have to change her diapers, and I have to give her medicine. So that is why I don't sleep full night's sleep. But somehow our body will adjust. That's why if you have you can't do this alone. For me, I can survive without a full night's sleep, because my job is only dedicated to take care of her. The grocery, the house cleaning, the food for myself is all being taken care of. There are others who help me to do it. If let's say you're coping on your own, it's going to be like an impossible process, because you will need to get out of the house to do grocery and all this, and you need people to assist you. You will need to lift them from the bed to the wheelchair. Now I'm actually doing it on my own, but then most of the time you will need 2 persons. Sometimes you need 2 persons to help when you need to call for help. Like for example, if they have a fall or something, so there's always have to be 1 person on a standby. You can't manage it if you are just staying with them alone in the home. Because once you place them on tube feeding, we have to restrain their hand. You have to put them on hand mitten. And once the hand mitten comes in, then there will be more bed bound. Even with the diet also, because the diet is liquid diet, semi-liquid diet already, they will be more weak anyway, so they won't be able to move as much. And with the hand mitten, they can't grab, because when we walk, we have to grab onto railings and all this. They can't grab on the railing, because if they can grab on the railing, then they're going to grab the tube and they're going to pull it out. So we just have to care for them an additional, like how we care for a bed-bound, like a stroke person. The difference between the stroke person and the Alzheimer, which is if both of them are on tube feeding, is that the Alzheimer person will be more active. They are not going to be responsive to cues and instructions, like when you turn them, because when they are bed-bound, we have to turn them every 2 hours or so. Then if you try to turn them, right, and if they don't like the position, you can bet they're going to turn back and lie flat on their back. So we just have to figure out ways to prevent the bed sores. I get my mother up, and then I actually will wipe her back, and then rub with baby powder. After that, I will rub with baby powder. So it will actually give some circulation. If she don't want to lie down, that's what I do, and I actually put her on a wheelchair and take her out once a day for an hour or so. Then she'll be seated upright on the wheelchair. And after I come back, we will do the big bath. So I would actually, we have to think about creative ways to adapt when we come with them. But it is a joy to take care of my mother. It's like caring for a baby. It's just that she's just bigger and she can speak compared to a normal baby. And also, my advice is if you are a caregiver, find other ways to make your life happier. There's a lot of meaning in caring for a person. I mean, sometimes, we pay a lot of money to attend courses or read self-improvement books to change ourselves. But sometimes that is not successful. For example, I have tried many ways to change my bad temper. I used to have very bad temper. But then because and I have attended course, I read books, I do meditation retreats, change my diet, it never worked. But when I care for my mother, I have to care for her. I find that there's no point arguing with a person with Alzheimer. You end up frustrating yourself, end up being tired and having no energy. So after a while, I really try to bite my tongue. I don't release out and say unpleasant things and don't want to make myself upset. And after a while, when you realize the futility of arguing with the person with Alzheimer and you stop doing it, it gets easier, and after a while you don't do it anymore. So and then I learned to be very patient when I care for her. And last time I used to have to follow schedule. I'm very particular about following schedule, but now it's actually about her schedule because it always changes and unexpected things always happen. So I have learned to be more flexible. These are skills that I think we pay money, we are not going to be able to. Even we learn it, but it's only on an intellectual level. But if we are willing to rise to a challenge when we take care of somebody, especially somebody we care deeply for, right, then it can be a catalyst for us to really change. And after changing, we actually become much happier. I myself personally, if you ask me, this is like a happy time in my life because I feel that I'm able to care for my mom. This is the time she needs me the most. And then some people say that we put them on nose tube feeding. Is it because it's more for ourselves and not really about them? And many people thought that when they don't eat means they are ready to transition, but it's not. They actually don't know what is happening. They actually just, the mind, just that part on the eating, they just stop processing. But if you put food inside, right, you can see the face is a lot of, when the stomach is full and they're not hungry and they have all the nutrition, the look is very different. So it's not doing it for our own self, but it's also for them, because if 100 years ago, if they developed this condition, yes, they will have to go because the medical science is not advanced enough to treat this condition. So most of the time, if they can't eat, means they can't eat already. There's no way to get the food in direct to the stomach. But now, with the advancement of medical science, it can be done. So why don't we do it? And I can tell you frankly, they want to live. If they have the energy, the reason why they are not talking, or they are very weak, or they don't want to respond, or they want to sleep all the time, is because they are so weak, because the body has no food. But once you start putting food and nutrition inside, you will see the change. It's just a matter of whether we can change the perspective of looking at the illness, and whether we still want to choose to take care of them. So of course we can only do it if financially we are able to do so, because taking care of them also incur medical expenses, and when we are not working, even our livelihood expenses also we have to take into account as well. So if we can actually, if we have no problem, we are okay with that, we can afford, then why not do it? For me, you can see that nowadays I'm more I do publish videos in YouTube. Maybe it take me like days to make a video out. For audio recording like now, I do in a single take. I don't have time to edit the audio. I used to have time to edit, but now I don't edit, so it's just a single take, and then I'll take my time to actually come up with a video while looking after my mom during my free time. This has given me a respite. It's given me happiness also, because I love writing, I love sharing. So find a way that we can, if we are a caregiver, right, it doesn't, we can also find things or hobbies that we always like, but we never have time to do, and then we can do it during the brief free time in between that we have. For me, I find that to share the knowledge and benefit other people that is in a similar position with me, and also may want to consider going to this road of doing the nasogastric feeding, it's been rewarding. At least it gives people a choice and give people an awareness. Whether or not you want to go ahead and do it or not is totally your choice and your decision, because everything comes with a price. I mean, I'm not talking about only the monetary price, but this also comes with a lot of price, and whether or not we are willing to make that sacrifice or not. So I hope that this video helps, but again, what I want to emphasize is that when they can't eat, it is not the end. It is not the end. It only will be the end. For sure, there's only going to be the end if, let's say, if they don't eat and we allow nature to take its course. And then once food is not getting in enough, once the organs are severely deprived of fluid, and fluid actually brings oxygenated blood. If everything is not flowing, then there's only going to be one outcome: they won't survive. But if we go on tube feeding, we have to pay a very high price, because there have to be a lot of caregiving, but they will survive. And with proper nutrition, they will regain their energy and vitality, and then they will be back their cheerful self. So in the end, the choice is up to us. Take care.